promote a positive balance between efficacy and side effects. Now, genetics and biomarkers also are challenging when it comes to lupus. Complex genetic factors play a major role in the susceptibility to SLE, with more than 100 single nucleotide polymorphisms having been identified in the past 10 years. But these genetic factors as yet have uncertain clinical utility for either diagnosis or treatment. Moreover, behind the importance of SLE clinical manifestations reside a high number of molecular mechanisms linked to a complex genetic expression. The markers that have long been associated with SLE, such as anti-double-stranded DNA antibodies and complement, are not sufficient for further refining treatment for the disease. Additional factors. Activating factors are currently being researched as representing targeted pathways for new biologics, while non-coding RNAs may prove helpful for detecting flares. This Friday coming up on My Story, Living with Lupus. She's a motivational speaker, an entrepreneur, and she's talking to you sister to sister. I'm talking about Sheila Smith, the creator of Right Side of 50, will be joining us this Friday on My Story, Living with Lupus. All aboard First-Time Cruisers, presented by Parisian Park Dreams and Themes. Cruise with a twist, Right Side of 50, hosting a session, stepping into my newness. Door prizes, raffles, and fun in the sun. April the 2nd through April 6th, 2020. Jacksonville Cruise Port, Jacksonville, Florida. Deposit $150 due July 10th, 2019. Ports of call, Freeport and Nassau. $579 Ocean View per person, $554 interior per person. Contact 770-982-9399 and ask for D Parks. Another challenge is managing comorbidities and pregnancy. Increasing patient survival has heightened the importance of addressing comorbidities such as cardiovascular disease and osteoporosis. For cardiovascular disease, many factors contribute, including the disease itself, treatments, and conventional risk factors. Risk calculators that have been developed for the general population substantially underestimate risk in SLE patients, and new approaches to evaluating risk are needed. SLE also is associated with low bone mineral density and fractures, again with multiple contributory factors, including the use of corticosteroids, vitamin D deficiency, resulting from photoprotective measures used by many patients in early menopause among young women who are treated. They further stated that they believe that a thorough assessment of bone status is essential at the time of SLE diagnosis, and if low bone mineral density is detected, an examination for asymptomatic fractures is warranted to help determine whether anti-osteoporosis medications are needed. The outlook for SLE patients who wish to become pregnant has greatly improved with experience at major centers showing that good outcomes are most likely when disease has been inactive for at least 6 months and the damage scores are low. In the largest study undertaken of pregnancy in women with SLE, the rate of uncomplicated pregnancy was 81%, according to the study's lead author, Jill Bunyan, MD, Director of Division of Rheumatology and the Lupus Center at NYU Langone Medical Center in New York City. The study solidifies that for many women who are in remission or have minimal disease activity, pregnancy is not going to make their disease worse, and they can have healthy babies. Nonetheless, the management of SLE during pregnancy is challenging because pregnancy complications can mimic SLE flares. Antiphospholipid antibodies can lead to both maternal and fetal adverse events. Now, holistic approach. Now, finally, the authors advocated for concurrent addressing of the various aspects of disease and treatment, including adherence and patient-reported outcomes such as quality of life on a holistic approach. Fatigue is another important aspect of the disease that is particularly troubling to patients. We believe that we should conduct more and better design trials to evaluate non-pharmacological intervention such as physical activity, psychosocial support, as well as pharmacological interventions for the reduction of fatigue in SLE, targeting disease activity and other dimensions such as depression and anxiety, they concluded. Now, cardiac dangers arise early for minorities with SLE. Minority patients with systemic lupus erythematosus had high rates of coronary artery calcification, even at very young ages, researchers found. Among a cohort of patients that was 40% African American, and 33% Hispanic, 42.1% had detectable coronary artery calcification with scores above 0. Now, among those who were ages 18 to 32, coronary artery calcium scores above 0 already were detected in 29%, the researchers reported online in Lupus Science and Medicine. Cardiovascular disease is a major cause of death among patients with SLE, and conventional risk assessment tools are unreliable for these patients. So better methods of estimating cardiovascular risk are needed. Coronary artery calcification scores estimate the degree of calcified plaque, and scores above 0 have been shown to independently predict mortality in the overall population. Previous studies also have found high risk of calcification among patients with SLE, but the patients in those studies were predominantly white. Now, to examine rates among minority patients, the group enrolled 76 patients from the Columbia University Lupus cohort who had no history of coronary artery disease and had chest CT performed and calcification scores calculated. Population controls consisted of participants ages 33 to 45 in the coronary artery risk development in young adult cohorts. Coronary artery calcification scores were analyzed, variable of any detectable calcification, that is, scores above 0, and as categorical variables with scores of 0, 1 to 99, 100 to 399, and 400 or higher. Co-varieties included hypertension, diabetes, SLE severity, and damage, and laboratory variables such as lipids and autoantibodies. Patients' mean age was 40 years. 90% were women, and disease activity was moderate. All had anti-nuclear antibodies presence, and 2/3 had high levels of double-stranded anti-DNA antibodies. Hypertension was diagnosed in 43% and diabetes in 10%, and 15% reported a history of smoking. Now, with all the side effects to the medications that some of us take, why did they not mention the medication side effects? I know several people who have taken these medications and never had diabetes before in their life, but now they are diabetic. Now they are have hypertension. So I wonder why in this study, that with all the side effects of medicines, that that was not taken into consideration.